Don't let stress get you. Find something to manage. If you're feeling stressed, find something that works for you to manage the stress. I mean, even something like, count to 10. Something that simple really works. What I tell to my staff from time to time, because they get pretty stressed out and tend to just have knee-jerk reactions, so what makes us different, remember Pavlov's dog, they would ring a bell and the dog would salivate because it was so, they trained it to respond that way. The difference between the dog and us is we have the ability to process. We aren't a stimulus response being. We have the brain that we can think about, we can evaluate the stimulus and then decide how we're going to respond to it. And just to think about something like that, you can avoid getting stressed out about things. It's like, I have no control over that, there's no point in being stressed. You have a choice how you react to things.
Nice picture.
Yeah, I like that one. It had nothing to do with anything, but... And don't stop dreaming. Have dreams for your future. Have plans for your future, because it's something that drives you forward.
Oh, I thought that tied in with the 8-hour sleep.
Well, this is a little different kind of dreaming. But hey, you never know what ideas you're going to get from that. All right, next, part 2, be informed. I want to focus really a little bit on medications here, because polypharmacy means when you're on multiple medications. And how many, is anybody here on like 3 or more medications? And that includes aspirin, vitamins, Tylenol, if you do anything herbal, that counts as a medication. 3 or more, you are at risk for complications of polypharmacy. And a lot of people end up in the hospital related to drug interactions and problems like that. So make sure when you go to the doctor that that physician knows everything you're taking. And that's all the things I said. I use aspirin, I take a vitamin, I drink herbal, this herbal thing or whatever it is. You want that physician to know what you're on. And it's a good idea to just carry a list. You also want the doctor to know if you've had allergies to anything, or if you've ever taken a medication and had an adverse reaction or a serious side effect to it. And when you get a prescription from the doctor, make sure you can read it. Because if you can't read it, maybe the pharmacist can't read it either. And if it can't be read, give it back and say, sorry, you gotta write this so it can be read. And make sure you get an explanation about your medication in terms you can understand. You don't want it explained in a bunch of medical jargon. It needs to be explained. I'm a nurse and I don't even want to hear the medical jargon. I want it given to me. Don't talk to me like I'm a nurse. Talk to me like I'm not. So plain everyday English. When you get your prescription filled, ask the pharmacist, is that what my doctor prescribed? Twice I have gone home from the pharmacy myself with the wrong medication in a bottle. And I only knew it because I'm a nurse. And I knew that wasn't my husband's cholesterol pills. The same guy did it twice. We don't go there anymore. But ask him if this is what the prescription was for. Again, clear instructions. You get 6 doses, 4 doses. I have to take 4 doses a day. Does that mean every 6 hours? Does that mean 9 a.m., 1 p.m., 5, and 9? Get the clear instructions. What does that actually mean on the label? And always use the same pharmacy. Pharmacists now are keeping data banks, and whatever prescriptions you have filled, they're going to enter that under your name. And they're going to know if you're getting into medication issues where you might have problems. I've seen it in home care where we take a medication list on one of our patients and they're on a diuretic called Lasix. Well, and then further down on the list, they're on another diuretic called furosemide. It's the same thing. It's the same thing. So one doctor gave Lasix and the other doctor gave furosemide, and because they used 4 different pharmacies, nobody caught the error, and the patient's taken a double dose of medication that's not necessary. So use the same pharmacy.
The other reason is because your medication is crossover and cross-reaction. You're taking 2 different ones, if you're going to 2 different pharmacies, they may not know that you're on.
They won't. Yeah, they won't know. They won't know.
They'll also get familiar with you.
I'm sorry.
The pharmacists will also get familiar with you.
That's right. That's right. And they're a wealth of knowledge. Next thing is about hospitals. You want to be informed about hospitals. If you're a patient in a hospital and the nurse or doctor comes in to do something, tell them to wash their hands. I mean, they don't. Did you wash your hands? What should they do? If you're having surgery, put your initials where your surgery is supposed to be. I had knee surgery. I wrote on my leg, this leg. Seriously, do that. X marks the spot.
Yeah, you don't want to walk out with breast implants.
Yeah, you don't want them to do surgery on the wrong leg or the wrong arm or whatever. Yeah, you want to. I mean, actually, and my doctor, when he saw I did, they said, "Oh, I was going to have you do that." So, some of the doctors are on board with that.
I'm having surgery on my shoulder blade. Is it okay if I write it backwards in the mirror?
Sure.
Okay.
Sure.
It's true. I'm having surgery this week.
When you go home, make sure you understand what the plan is for you once you get home. What are the discharge instructions, and is there anything that you're going to have to do when you get home? If possible, if you anticipate a hospitalization and you have a choice of hospitals to go to, do a little homework. They now are putting performance outcomes online, and you can go to Cal Hospital Compare, and it's going to tell you, like, if you're going to have heart surgery, how does O'Connor Hospital do with heart surgery? They're going to tell you that and compare all the hospitals. So you've got a choice. If you want to go to one that's got a good track record for whatever it is you're going in for. Another website. Oops, I went to. I don't know how to go backwards on this. Oh, there, thank you. Hospitalcompare.hhs.gov is another site where you can get the statistics on your hospitals. Okay, and then the third thing is advocate for yourself. Prepare advance directive and durable power of attorney documents if you have not done that. If you can't speak for yourself and you're in a healthcare crisis, you don't want, and you're